Welcome back to Morning Rounds. We are your hosts, Austin and Cherrae Whittington. Today we'll be breaking down GLP-1 medications, semaglutide and tirzepatide, and the hormone system they mimic inside your body. I think a lot of people hear GLP-1 and immediately think it's a fat-shedding medication. But that's not actually what these peptides do. Today we're going to break down how GLP-1 peptides actually work, what they do, what systems they affect, and why the weight loss is really just a side effect of something much bigger happening metabolically. So Cherrae, break these down for us. People use GLP-1s as a tool for appetite suppression. How does this happen in your body when taking these injections?
So medications such as semaglutide are really just mimicking our natural GLP hormones that are made in the body naturally. Those are termed incretin hormones. There are GLP as well as GIP, and with time they just don't work as effectively anymore. So giving a patient semaglutide is just mimicking those natural hormones, which will contribute to them having delayed gastric emptying, which slows down the GI motility, which makes the food process slower, which leads to them feeling full for a longer period of time.
So tell us a little bit more about how GLP-1s can help lower blood sugar levels.
So the GLP-1 medications helps the body's pancreas actually release insulin when it's needed. So not just at random times, it also helps to improve the sensitivity of the receptors, so your body responds to it better. But more in particular, it does control release of insulin when that's actually needed, when your glucose is elevated from meals, not just sporadic, which leads to things like insulin resistance.
A common misconception when you come to a non-insurance-based clinic like MP Modalities, there isn't a rigid checklist that says you have to be a certain weight, a certain BMI, or already diabetic to be considered for GLP-1 therapies. We like to check lab markers prior, not because you have to fail them, but for safety oversight, and it gives us a way to track your progress, not just by a scale. The final decision is always made clinically, one-on-one with your provider. Cherrae, tell us some more reasons you would find it clinically appropriate for a patient to be prescribed GLP-1 injections.
So the most common reasons why we prescribe, typically patients are coming in for weight loss concerns, but honestly these medications do provide just an overall metabolic reset for a lot of patients. They reduce things like inflammatory conditions. So patients that have had conditions such as lupus or MS or rheumatoid arthritis, anything that contributes to aches and pains, or just that feeling of overall systemic inflammation. These medications can be wonderful at reducing inflammation just in general. Patients that have conditions such as inflammatory bowel disorder, they often report that they feel a lot better being on these medications. There is a improvement in just overall cognition and focus and well-being. Mental health aspects, people feel better when they're at their weight and they're in the skin that they want to be in. Even down to any conditions that are fueled by insulin resistance, things like PCOS, fertility issues even. Sometimes women will come and they'll want to drop some weight, reduce some inflammation before they have a pregnancy. So these are all common conditions. Sleep apnea, they're showing that it's very promising for things like fatty liver disease. The list is ongoing and it seems like every single week we're adding something else to the mix. I would never just disqualify somebody from using these therapies. It really should just be an individualized approach with the patient, determine what is the overall goal that that person's seeking. And then from there, we kind of decide together whether or not that's an appropriate action.
And that just goes to show there's several benefits to these GLP-1 injections, other than, just type 2 diabetes or medical weight loss. But let's go into the side effects. Nothing's perfect. The two most common side effects people worry about and that we see are nausea and constipation, definitely with the gastric emptying, the delay in that. Cherrae, are these preventable?
For the most part, yes. Some of the things that patients can try to do to prevent things like nausea, for one, just mindful eating, making sure that you're eating to 80% of being full and you're not overstuffing your stomach. I know a lot of my weight loss patients have tried multiple things in the past and they don't feel like anything's going to work for them successfully. So when they take medications like this one, they kind of get that mindset, not realizing that it does work a lot more effectively for most patients. So you do have to make changes to your lifestyle habits That also leads me over to trigger foods. There's a lot of things during consultations that we cover with patients to try to avoid putting in their diet, certain beverages that they have, even certain times a day that they're eating. All those things matter. And changing of injection sites or changing the way of like injection protocols as far as frequency goes. Sometimes that is a way to mitigate the issues with nausea. A lot of pharmacies are starting to put in other vitamins into the mix that can kind of help to reduce any of those GI side effects too. So anything like that is pertinent. It's usually transient most of the time with these side effects as well. So once the body gets adjusted and the patient gets adjusted to being on the therapy, and they kind of realize through trial and error what they're able to do with it, what they can't do with it, they don't see as much of these side effects occurring. Constipation, that's going to be fair game with any of these medications that patients are taking, especially if they already carry a history with that. All the good bowel health things that we've always, kind of preached at the public, making sure that fiber is adequate, making sure that water intake is great. Even if you think it's great, increase it more, put some electrolytes into the mix. There's several over-the-counter things that patients can try, but always caution them that those are meant to be more so on the short-term side of things. So just doing all the good things for bowel health in general, trying to stay regulated, treating that issue sooner versus later. All those things can kind of contribute to a healthy experience and a more manageable experience with these medications, which is obviously our goal.
And like you said, it's trial and error when it comes to different foods and drinks that we intake while on these injections. That's why we have a care team. That's why we do check-ins here at NP Modalities to see if you're having issues or not. I think honesty kind of helps with that. We don't want anybody going 2 to 3 months with an issue and not bringing it up.
And I think honestly, a lot of the times that's just patients being afraid that they're going to be taken off a medication that's actually working for them. Our goal is for them to have a safe and good experience with these therapies. So the biggest key to that, and which is the success in just in general, is the communication portion. Making sure that you are supported and heard when you have certain concerns, and making sure that those concerns get addressed so that an intervention can be put in place if necessary.
Yeah, like you said, our care team's here to help, and if it's something that they can't assist with, we'll always have follow-up appointments available to meet with your practitioner and to go over and get everything situated. Our mission with this podcast is simple: educate, simplify, and help you better understand your health. We believe when you understand your health, you're able to make informed decisions with confidence. If you have questions you'd like us to cover on our future episodes, you can submit them anytime to info@npmodalities.net or message us on Facebook. Thanks again for listening to Morning Rounds with NP Modalities. Until next time.